It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it's great to have you in studio with us today. We're sitting down with Yavapai County Health Department Epidemiologist Stephen Everett. Welcome back to studio.
Hi, good to be here.
In person.
Yes.
Nice to see you here.
Oh, it's good to be out of the office.
Last time I saw you in person was in February 2020.
Yes.
We sat down to talk about a little thing called COVID-19 that was raising its head in China and had jumped into a couple other countries nearby.
Yeah, whatever happened to that?
Oh, man, talk about dominating things over the last year and a half now.
Yes.
And my first question I wanted to ask you was, as an epidemiologist, we've talked about pandemics and the ones that have happened before, and they were close to jumping around the world, but they didn't.
Yes.
But every time I've talked to anybody from the Yavapai County Health Department, it's always been the answer, it's not a matter of if it's going to happen, but when and where it's going to happen.
Absolutely.
And I've been here almost 30 years, and so that's been kind of the conversation all those years. And then, boom, it has happened.
Yep.
What is it like to be an epidemiologist and actually have an actual worldwide pandemic happen while you're working?
When it's somewhere else, it's very, very exciting because you don't really have to do any work on it. Once it gets here, it's a lot of work. We had a lot of people come back to help us. Two of our retired public health nurses came back. We had a load of volunteers that were doing the interviews, manning the phone bank, answering questions. You know, of course, the clinic staff that were giving shots, doing testing. So it was a big team effort. It wasn't just me. My focus actually became narrower as it went on because it was just so hard to manage just by myself. So once the novelty wore off, it was a chore.
Now, one thing I've asked you guys in the past too is, were we prepared for a worldwide pandemic to happen? What do you think about that? Were we ready for something like this?
On paper, yes. We have loads of emergency plans. So everything happened just as we expected. But on the other side, the preparation with actually having materials on hand. At the beginning we had shortages of vents, medical equipment, masks, gloves, surgical gowns. That was the hard part. So it doesn't matter how good your plan is if you don't have the materials to actually carry it out.
On a side question there, when we talked about the shortage of those items right there, the PPE I think is what we were calling, right? The PPE.
Yeah, personal protective equipment.
Yeah. Is that something you can stockpile and actually hold on to for years, or do masks and the gowns and stuff actually have sort of an expiration date?
Yeah, they do have an expiration date.
So it's not something you can stockpile then?
Correct.
Okay.
And if you stockpile it, you have to have some place to stockpile it as well.
Sure.
So storage is at a premium.
And then finances in order to update that stuff as it goes along. All right, so are we out of the woods yet? The world seems to be opening back up.
Yes.
I was in Florida recently and nobody had a mask on. I took mine off as I left the airport. I was vaccinated in March with the Moderna vaccine. I took my mask off when we landed at Panama City, and I didn't put it back on until I had to get back into the airport and go back onto the plane. And as we were walking around Panama City Beach and driving around, I noticed really hardly anybody at all was wearing masks anymore. Disneyland, Disney World are back open again with the restrictions taken away now. And I'm just kind of curious, are we out of the woods yet? Should we be doing that yet? Or where are we at in terms that you think?
We're not out of the woods just yet.
Okay.
Mostly because there's still a good chunk of the population that hasn't been vaccinated yet. So we encourage people to go get vaccinated. It only gets 2 shots and it's free. So you can just go to just call the local health department and they'll set you up with an appointment where you can get it.
Physicians still doing the vaccines as well, and like CVS Pharmacy, Walgreens, and that, are they still?
CVS and Walgreens are. Individual physicians, it depends on the physician.
You have to contact your physician and ask them, right?
Just call ahead, and if they don't have it, they probably know who does and can direct you to someone that can get you the vaccine.
So we all should still be careful out there.
Yes.
And, and you mentioned when you were here in February 2020 that the mortality rate would be 2 to 2.5%. Did that ring true?
We're at about 2.7%. That's the crude amount. We have to take into account that we have a much older population in Yavapai County, so that kind of throws off our numbers. We have to adjust for that. So it would be lower than 2.7.
Are numbers going up again? Because I've noticed that I use the Arizona Department of Health Services data dashboard. Each day before noon or at the noon newscast, we have those numbers on the air. And I noticed that a few weeks ago we were talking about, averaging about 300 to 400 cases a day. And then last week it was maybe 400 to 500 cases a day. And then yesterday the state health department put it out and was 769 cases. So are we seeing an uptick in cases again?
Yeah, Tuesday and Wednesday are always going to be kind of high because they're catching up from the weekend.
Okay.
If you notice, every Monday there's never any deaths.
Right.
So they just haven't got the paperwork and processed it yet. So it'll go up, it'll go down. It's probably better to look at a 1 week average, 2 week average. Yavapai, we've been staying fairly steady. So it's been running about high singles, mid-teens, about that area.
Do you consider that all right? Is that pretty average?
Good. That's pretty good.
That's pretty good. All right.
Yeah.
Okay.
It's not great, but
it's not great, right? We still have cases showing up, and that's what we want to get to when we start talking about this variant, and we'll get to that really quick too. Yes. I was looking over the numbers this morning, and I jotted them down. And Yavapai County, as of yesterday, had 19,595 cases, 528 deaths in the county, which is sad news. 159 vaccinations were given on Tuesday, at least that's what the state was reporting up for us on Wednesday. And then 43.6% of residents are vaccinated in Yavapai County. And I've been kind of comparing it with Coconino County just to see the differences. Coconino County is more than 1,000 cases less than we are. 331 deaths, and then we had 528 deaths so far. 266 vaccinations given out Tuesday as opposed to our 159. And then their residents vaccinated in Coconino County is 51.5%, which is pretty. Do you have any idea as to why there's that difference in numbers between Yavapai and Coconino?
For the percentage vaccinations, they were hard. The Navajo Nation was hard hit by the virus.
Very.
So I think it was more in the news up in Flagstaff, so people were more aware, more likely to get vaccinated. The groups here in Yavapai County, the highest vaccinated are those 85 and older, and then it goes down by age. The least vaccinated are going to be our children.
Yeah, 65 and older, with your last report put out yesterday, 68.5%, 65 and older are vaccinated. 55 to 64 is 44.9%, 45 to 54 is 35.3%, 35 to 44 is 31%, 20 to 34, 26.2%, and then 20 and under, I guess, is 6.5%. Are we getting any closer to having a vaccine for children under the age of 12? Do we know that yet?
We're probably closer. Usually it's a situation where they have to determine whether it's safe for kids or not. It most likely is, but they have to have a certain level of children vaccinated in their test group to make sure that it's safe.
Do you know what that number is, and do we have that number yet?
Not off the top of my head, no.
Okay. All right. Let's take our first break. Yavapai County Health Department epidemiologist Stephen Everett is in studio with us today. Website for the whole county is yavapai.us. Stick around, Countywide back in just a couple minutes.
Who doesn't dream of home improvements? Perhaps your kitchen, the real living room. Maybe the bathroom, where you bookend your day. Langstrand Contracting is your one-stop shop from tear down to finishing touches. With 35 years of experience, Chris and his team will work with you to match your family's style and budget. Call Langstrand Contracting today for guidance in bringing your vision to life.
Hi, this is Greg at Verde Solar Power. You know, Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, The energy solution comes up every morning.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle, get Gettles.
Welcome back to Countywide. Yavapai County Health Department epidemiologist Stephen Everett is with us in studio today. We're talking about COVID-19. Now, over the years when we've talked about pandemics and the flu and any kind of virus that's going on, disease in the country, I always heard that the reason we get vaccinated is because the more a disease has a chance to jump from person to person to person, the more apt it is or could alter itself. And that's the real reason we want to get the public vaccinated, is so COVID-19 doesn't get to jump around and decide it wants to either become a weaker variant or a more powerful variant. And right now we got the Delta variant, and I was hearing yesterday it's in 49 out of the 50 states. So what do we know about the Delta variant, and is this something to be concerned about?
We have one Delta variant that we detected in Yavapai County so far.
Okay. And how long ago was that?
That was beginning of June.
Okay.
So we haven't seen any yet, but not every person gets their genome tested for the variants.
Okay.
So we only take a sample and then look at those. But yeah, there's no way we'd be able to do it each and every person. So the fact that we detected one means it's here. There's probably a lot of other people that have it. It has been doubling every week, every 2 weeks in the country. So it's definitely taking over.
The original COVID?
The original COVID, which is not unusual. This one's more efficient at transmitting, so it goes from person to person a lot easier. The symptoms are a little different. This one, it's more like a bad cold, which means people are more likely just to toughen through it. So they may go to work, or they won't seek medical care, so they don't get tested, so we don't know about it. So, and it seems to be affecting younger people more, and they're the least vaccinated of all the age groups. So we worry about that as well. And they're the most social as well.
So it's almost like it looked for a different host, basically. It's like, well, all these older ones are getting vaccinated. We can't get into these guys anymore. So look at this. These are the kids, 12 and under. Perfect.
They were able to evolve into certain benefits that, filled a niche.
And that's always been our concern about these types of things when they start moving around, especially if it's a worldwide pandemic.
Absolutely.
Okay. Herd immunity.
Herd immunity.
So let's go back to the Delta variant. You said it's like a very bad cold. So you were telling me off camera that the taste and smell, where people were losing that with COVID-19, that's not necessarily the case with the Delta.
It's a lot rarer with the Delta virus. So that loss of taste and smell, I thought that was like a benefit of the original one. I was hoping I would get that when I had COVID, but this one does not have that, and so they might not think it's COVID. And so that's always a risk.
A bad head cold, like runny nose, coughing, sore throat?
Runny nose, coughing. Don't get the sore throat.
Headaches?
Headaches, yes. It does have the bad headache.
Okay.
So usually I'm finding a lot of people complain about the headache.
Okay.
So if you have a bad cold and a headache, definitely consider going to see the doctor and get tested for COVID.
Okay, and that just helps you guys track it and see where it's going and what it's
Absolutely.
doing. Okay.
And then we also, any case that we get, we contact, and we find out who their contacts were, the people they were in contact with, and we try to get a hold of them, quarantine them so they don't spread it farther.
Is it more deadly than the original COVID that we were dealing with?
I haven't seen that. It just transmits a little harder.
And COVID already
faster.
transferred very quickly. I mean, it was
Yes.
it was a super spreader to begin with. So now this is like a double super spreader.
Yes.
This guy goes even faster.
Yeah, it's COVID spreads a lot faster than flu. The flu season last year was almost non-existent because the social distancing, the masks, it was the perfect thing to keep flu from circulating.
That was one of my questions for you. Did we see less flu cases last year?
Yes,
I've had
a
people
lot.
say, well, we're talking about COVID every day. Why aren't we talking about flu cases every day? What about flu cases? And I said, from what I'm understanding is that flu cases are actually way down just because of everything people are doing to avoid the COVID.
Yes, and that's not just the United States, it's all over the world.
I'll be darned. Herd immunity. Let's get to herd immunity. There's a lot of questions about, well, I had COVID-19. I survived COVID-19, so therefore, why would I go out and get vaccinated? And then I never had COVID-19, as far as I know, I never did. But when it became available for the vaccination in March, I've got a granddaughter I never saw, a new daughter-in-law that I'd never seen because they had all took place last year when this started. And so I thought, well, I'm going to do what I need to do to get on a plane and be able to go someplace and see them. And so we did. We got vaccinated. Do we reach herd immunity with people who are vaccinated and those who have already gone through it, maybe once or twice already and survived it?
Technically, yes. We still want people who have had it to get the shot. Any booster shot is going to help your immune system. So that's really good. You want to keep your antibodies up. That's what protects you. Over time, it does drop. Tetanus shots, you're supposed to get those every 10 years because the antibody drops, you want to boost them back up again. And COVID, if you get COVID shot and you have COVID, that just is insurance.
Okay.
So definitely have it. Don't rely on herd immunity because it's fairly high. We usually look at 70-80% in general. It all depends on the agent. Some have a lower threshold, some have a higher.
Okay.
And in Yavapai, we don't have a great vaccination rate. We're one of the lowest in the state just with the regular vaccinations.
Yeah, 43.6%.
Yeah, so we worry about that as well. So if we're not doing well just with the regular vaccinations, with this, we're not really counting on herd immunity too much.
Okay. All right. So we're not really looking, because I know the president was trying to get 70% of adults, or those who could be vaccinated, vaccinated by, well, 4th of July.
4th of July, yeah.
Yeah, and we've not quite reached that in the country. Where are we at? Do you know in the country, the number? I don't have the number in front of me either.
Yeah, I don't know in the country.
Okay.
I know it's been tapering off a lot. We're seeing less and less people get vaccinated.
Well, that's just it. I hear people say, I had COVID-19, so why should I get it? I'm basically building up my immune system naturally. And I understand that aspect of it. I truly do. But then again, are they as prepared to receive COVID-19 in their body as somebody who is vaccinated is? Because the vaccination rate is really good. Not the rate, but the vaccination coverage is really, really good. I think I'm 95%.
Depending on the vaccine, it's in the 90th percentile, which is really, really good.
And then, like I said earlier in the show, I heard yesterday that it could be something that's going to be a lifelong thing. Are we seeing maybe? It's too early to tell if we're going to need boosters, isn't it?
Yes.
And I know we're working on a pill form. They're working on a pill form for the vaccine as well.
Right, and we don't know how much it's going to mutate. So it may come like flu, where we have to get shots every year because it's mutated so much, the vaccine won't cover it.
And so like the flu, we have to watch the southern hemisphere to see what the northern hemisphere is going to put in their flu shot and vice versa.
Exactly.
But COVID's not like that. It doesn't pick hemispheres. It doesn't pick temperature. It doesn't pick hot, cold, or any of those things. Nope. Elevation, nothing. It doesn't care what it is. That's why it was such a super spreader. Yeah,
it's a totally new virus that we just caught us totally by surprise. All the pandemics before have generally been flu. That's what we were expecting. So fortunately for us, that COVID is a respiratory virus, so all our flu plans could easily switch over to COVID.
Okay, all right.
So that worked out really well for us.
Let's take our second break. Yavapai County Health Department epidemiologist Stephen Everett with us today. Yavapai.us is the website. Stick around, countywide, back in just a couple minutes.
Terrifying jobs. Bull rider, take 2. Cliff, this seems like a really terrifying job. Why do you do it?
I love protecting the bull riders when they get bucked up.
How big are these bulls?
12 to 2,200 pounds of pure muscle.
You're not cowed by any of this, obviously. Is there anything that scares you?
Yeah, distracted drivers terrify me.
Two things we can count on every year.
A new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in-ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at candbhomes.com.
Award-winning Soundbites Grill is an entertainment restaurant located in uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Welcome back to Countywide. Just a few minutes left of the program. Stephen Everett, epidemiologist for Yavapai County Health Department here today. We're talking about COVID-19, the variant, the Delta variant. There's other variants, aren't there?
Yep, they're all done right now. The World Health Organization is using Greek letters. So Delta is the 4th letter. I think it's down to...
Oh, I see how this is working.
Iota, Kappa Iota. So there's about 15 variants right now.
So COVID-19, our original COVID-19 has changed that many times, where there's just these slight little changes.
Yeah, it's changed a lot. These are just the variants of concern.
Okay.
So these are the ones that they're worried about. There's a lot of variants that are really no different from regular COVID, or they are less potent than regular COVID, so they don't name them.
It'd be nice if they were all less potent than the original COVID that came here.
Yes.
All right, well, we'll have to see if that happens, huh? And you want to encourage people to get vaccinated.
Get vaccinated, even if you've already had COVID. Wear a mask when you can, social distance when you can. It's no longer a requirement now, but it keeps you safe. And if you're sick, stay home, see a doctor.
That's the one especially right there. If you're sick, stay home.
Yes.
We've been saying that all the time.
Absolutely.
Even before COVID was here. So if you don't feel good, don't take it to work and then spread it around and give it to everybody there. Just stay home.
Yeah.
It's hard to do that, though. I, for one, am like that, where I've think I've had 2 sick days in all the years I've worked here. I just don't like to stay home.
Yeah, I don't either. But you have to look at it. You go to work sick, get your coworkers sick. They stay home. You're going to have to do their work.
Yeah.
So it benefits you.
Right. Yeah, exactly right. You cover me, and then we won't have to cover you later. All right. And then we want to get our vaccination rate up in Yavapai County. 43.6% is of residents vaccinated in Yavapai County at the moment. 51.5% in Coconino County. Statewide. AP had a story today where they were saying it was just over 40% in the state, but the state number is right now 49.5%. So almost half the state is vaccinated.
Yes.
So that's nice to see.
Very much.
But we would like to see that number to get, obviously 100% is not going to happen, but it'd be nice to get it up to what, 70, 75%?
70, 75% is our target. Whether that actually gives total herd immunity, that's up in the air. It's always hard to tell, but get the shot. It's simple. It protects you. It protects your friends. It protects your family. So it's going to do a lot more than just taking care of yourself.
Yeah, all right. That's all we got time for. 17,936 deaths as of Wednesday's report of the data dashboard. That's today's Countywide. As always, we thank you so much for watching, listening, and we will talk to you again next time.